guys, I am Dr. Siraj Ahmad, the faculty of Pharmacology at LN Next. I hope all of you guys are doing good, and I'm here to actually quickly discuss with all of you guys what should be your strategy for Prof 2, especially with respect to pharmacology. Now, speaking of pharmacology, remember guys, it's a very beautiful subject. Most of the students, they are terrified by maybe some of their seniors' feedback, or maybe due to reasons that are unknown. So they take it as a headache rather than taking it as a lovely subject. Now, why do I call it as a lovely subject? Very simple reason. You see, definitely the first prof is important: anatomy, physiology, biochemistry. In anatomy, you'll be reading the structures, the normal structures. The function will be in physiology. Biochemistry, they'll be teaching you about what is the biochemical level or the different cycles that you have. Pathology, you'll be taught about the different diseases, their pathology, right? Then medicine, you'll be taught about the diagnostic, and other subjects likewise, right? You'll be taught about many other stuffs, but only in pharmacology you are going to actually study the drugs. Where are these drugs working? What is the rationale behind adding this drug? What could be the possible ADR, adverse drug reaction of this drug? Everything about your clinical practice you are going to study in this one. I mean, Prof 2 pharmacology. So overall, as a whole, Prof 2 is always considered as a very important prof for all of you guys, because they are having important subjects like pathology, pharmacology, and microbiology. Most of these subjects are directly or indirectly interlinked with your clinical subjects like your medicine and surgery and other clinical subjects that you are having. Okay, so let us see that what should be your approach for this subject. Now, while we were discussing the problem with the other students, that what is mainly the issue why you are not very comfortable with the pharmacology, because again, when I meet 10 people, most of them, like let's say 5 to 6 out of them, somehow they do not have this the comfortable environment with respect to pharmacology. I totally accept. When I was in second year, I was also not very comfortable with subjects like pharmacology or biochemistry. But again, as we proceeded, right, and we learned this subject, we find it much conceptual rather than just the drugs and ratification. We don't have to just go for mugging up this subject. Sorry for my word, ratification is just the common word that we always use. Anyway, so as I was telling you, what is the problem with when we discuss with many students, they said it's too lengthy, too many drugs, how to memorize all these drugs. We cannot remember all these drugs. That's not the problem. The actual problem is somewhere else. It's not too many drugs. You see, in one class there will be one drug. Let's say ACE inhibitors are all ending with pril. So just remember, all the prils are ACE inhibitor, or ARB, angiotensin receptor blocker, are all going to end with sartan. So just remember, all the sartans are ARBs. Likewise, if there's alpha blocker, right? So if you have a basic concept of alpha 1 blocker, all the alpha 1 blockers are going to end with zosine. So that is one way of handling the name of drugs. And second thing is, too many drugs. Definitely, you are going to be in different, a stream of clinical practice. There are supposed to be drugs, but you don't have to remember and recall everything at a time. At a time, you have to remember only few limited information, and that is why we are here to simplify the things. One more problem that the students have mentioned, that there is lack of time. See, time, when it comes to time, everyone is having almost similar kind of time. All of you will agree with me that all of us are given the same amount of time in Prof 2. No one is getting much time, but some of our students, they are coming in, let's say, rank 1, 2, 5, 10, or within 100, and some of the students are coming, ranks like 10,000. So it's just that the approach of one student who is getting rank 1 and 2 is literally different compared to a student who is having a rank more towards the expected, far from the expectation. So let me just quickly talk to all of you guys that reason why you're not starting, and reason why the students are not taking it as a very beautiful subject, and what should be your approach. So one of the reasons, when I when I was discussing, I found out there is a big problem is the students are not starting. There is a resistance in starting. They are not feeling comfortable. I always used to tell one story in my class, that when I was in class 12th, I was reading physics. I was so poor in physics, I was not able to understand, derive the numericals and all. So one day I met with my new teacher who came to the class, and he told something in class, that if you're poor in physics, it's not your fault. It's the teacher's fault who could not elicit an interest in the subject, because physics is a beautiful subject and he was totally in love with the subject. When I heard from him, I got a little bit of confidence and I said, okay, this is the person who is talking my language. I have to meet with this teacher. So I met him. I explained my problem. Sir, this is the problem. I'm not able to derive the numericals. Please help me out. Tell me what should I do. He told the same thing and he said, okay, there are a few things that I'm going to tell you and you can apply. And later on, we approached that faculty of mine to please start coaching. I was already into a coaching system so that I can crack the examination. But again, I asked him to give me some extra attention on physics, and we hired a couple of our friends. And the way he taught physics, I can still remember every single concept that he taught, and I can teach my kids if time comes the same way, in the same way, the way he taught physics. Likewise, guys, I'm telling you, if you are having resistance to start, it's the only reason is you have not read or you have not taught about a faculty who can elicit the interest in that. If some of you are having good interest in this, well, kudos to all of you guys. If some of you have developed interest by all of yourself and all by yourself, we are really happy and really happy to hear that, and you pat your back all of yourself. But at any point of time you feel there's a resistance to start, that is one of the main problem, because when you don't start, you don't understand. When you don't understand, you have less knowledge about it. When you have less knowledge about it, you hate it. When you hate it, you again have a resistance to start, right? So it's going to be a vicious cycle. We have to break this cycle, and that is why we are here for. My approach to all of you guys, that apply the fragmentation technique. What is the fragmentation technique? Don't try to take the whole subject like a big mountain. It's such a big subject. There are so many drugs. How will I study, right? No, no, no. Don't do that. Try to work on the basics. All of you in Prof 2, those who are coming here, just work on the basics. And for the basics, I would always say that take general pharma and ANS, general pharma and autonomic nervous system. If you have the basic idea about how, what is pharmacokinetics, dynamics, and what are the different steps involved in it, what is parasympathetic, sympathetic, what are the lytics drug, what are the mimetic drug. If you have the basic idea about this, believe me, you are going to fall in love with this subject. I'm telling you, because you are going to utilize entire pharmacology in throughout your medical career. Because you'll be writing on your prescription pharmacology, right? Definitely not pharmacology, but again the drugs, right? So just utilize the fragmentation technique, take a small topic, read it, revise it, and move ahead. Even after doing this one, the next thing that I will always be telling you, especially when you are in Prof 2, that remember there is no alternative to textbook. If you have to choose between any XYZ stuff and textbook, always choose your textbook and medical college, because the teachers in the medical college, I mean, you cannot replace that environment. But the problem is, whatever the environment was there, let's say 10, 15 years ago, that environment will really change. All of us will agree with this fact that that environment has totally shifted towards the PowerPoint based learning, and most of the students are not very comfortable in PowerPoint based learning. So sometimes they will be running PowerPoint, and we have seen, we all have worked in government settings, and we have seen how students are sitting at the back and having their own time, and faculty is coming in front and they will take the lecture and they will go. So there is no proper interaction between these students and the faculty. So if you have to choose, let's say, your medical books versus any XYZ, I would say there is no alternative to a textbook in any subject, especially in Prof 2. And pharmacology, I would say minimum, you can go ahead with the Sharma, KK Sharma, your KDT, and or you can go for Kedzen if you can. So just pick any of them. Don't go for many subject, many textbook. Just pick any one of them. And likewise, our patho faculty will be telling you that how important Robbins is. Likewise, our micro faculty will be telling you how important their textbook is. Right. So in pharmacology, I'm telling you, we'll be picking any of these. Start with the very basics. Our lectures that we have, it is just going to add on, going to supplement. If anything you could not understand, see, we have tried to make things little, easy with our easy mnemonics, with our study, easy study technique. थोड़ा spice up करने की कोशिश किया हम लोगों ने. We have tried to spice up things so that you can remember things for longer time. Yeah? So video lectures and any notes that is being provided, it will be acting as a supplement. So a quick disclaimer that there is no alternative to textbook in medical education, because guys, imagine 15 years ago, the kind of doctors that we used to see 20 years ago, and the kind of cardiologists, the cardiothoracic surgeon, neurosurgeon we used to see, they were not studying from any apps. They were not studying from, any kind of YouTube. All they were dependent on is on their teachers and the textbook. There were no such environment. But still, right now, we should be very, very, thankful to all the things that is being provided to us, that we have everything at a click of our finger. We just take our phone and the whole world of medical education is in front of you, be it anatomy, physiology, dissection, be it your pharmacology, all the lectures, be it surgery, all the surgical stuffs are going on the screen. So you can even access most of the stuffs from the comfort of your home. But again, I'm telling you, take these lectures only as a supplement if you are not able to handle that kind of environment. So what are the role we are going to play, or as a LN is going to play? See, all the lectures are properly arranged according to the topic wise. So let's say general pharma. General pharma in medical colleges is being taught around, I would say, 16 to 17 hours. But again, it depends. In some colleges, it will be 15 hours, some colleges, it will be 18 hours. It depends. But here in app, we have tried to summarize the general pharma in around 7 to 8 hours. But again, that 8 hours will be having almost everything concise. So it's not like you are going to leave anything. Everything has been concised. Okay, so there will be, most of the lectures are usually concept based with good emphasis on pathophysiology. So let's say if I'm going to discuss with all of you guys heart failure, I will not immediately start with the heart failure, that the drug of choice for acute heart failure is this XYZ drug. We are going to decrease the fluid volume by giving this XYZ drug, or I'm going to give inotropic support by any XYZ drug. What are the role of vasodilator? I will not immediately talk about the drugs directly. Go ahead with the go first with the pathophysiology. What is the symptom? Why is the patient coming to you? What could be the possible underlying causes very quickly, and then what are the different area we can target. Likewise, if I have to teach you hypertension, I will not start directly with first line drug for hypertension is this, second line drug for hypertension is this, and these are the ways that these are the drugs that we have. These are the ACE inhibitor, these are the ARB. No, my approach or our approach here is to give you why hypertension is developing, what are the steps involved, what is RAS system, how RAS system is adding on to the development of hypertension, how central mediated sympathetic activation is adding on to the hypertension. So once you have all the ideas, you can plot your drugs. So in the lecture, you will see that the favorite part is always plotting the drugs at different area. So next time when you prescribe the drug to your patient, you already have the idea, okay, at the back of your mind, that this drug that I'm prescribing for hypertension, it is going to attack this particular axis of RAS system, or any other drug that you're prescribing, let's say vasodilator. So this is how it is going to act in hypertension. So there is a very good, emphasis on the pathophysiology, and then after that we are going with the drugs, so that you can have a holistic approach on this subject. There is going to be a lots of mnemonics and stories to retain the information about the drugs. Right, so sometimes we can have stories about some actors, some actresses, story about some, let's say, some any random, let's say, for remembering valproate, I usually discuss about old grandfather in the age group of 50 to 100, who is very much effective in doing all the familial works, then doing all the extra familial works, and in his younger days he used to take shots of alcohol. So now he's lost his pancreas and liver, both are having in danger, trouble, or I would say the old grandfather, he has gained his weight, no hair, there's a tremor. So everything about the valproate has been summarized in this 2-minute story, that the old grandfather age is 50 to 100. So what is the 50 to 100? Is the therapeutic plasma concentration of valproate. Okay, then what are the different role of valproate? So valproate is a very broad spectrum drug, effective in familial, matlab epilepsy ke liye, effective in extra familial, that means it's also effective for many other conditions like Sydenham's chorea, bipolar disorder, prophylaxis of migraine, everything. Side effect, as I said, shots of alcohol, liver, pancreas gone, tremor, lost his hair, weight gain. So everything has been going to revolve around this old grandfather. And every time anyone is going to ask you what valproate, you don't know anything about valproate. You don't need to mug up things. Just recall, okay, there is an old grandfather who is having all this character, and everything is in front of you. Okay, just right. I'm sure you'll be able to write things by recalling these stories that we have. Plus, there is gonna be regular guidance and approach to write the description on the essay-based question on the YouTube, or we are going to have many other way, like we'll be having more lectures that we are going to shoot for all these students, those who are coming to the Prof series. So our role mainly will be to make sure to simplify things, to make sure that we are going to bridge the gap that the students are having between resistance to start and already a full fledged on the study route, on the conceptual route that they are going to be on, right? So this is going to be our role. Plus, I would always and always tell the students, start early if you want to reach somewhere more early, right? So that will be my last message to all of you guys. Thank you very much. At any point of time, we are just one click away from all of you guys through all the social media handles, and again in the app also. In the app also, if you are having any problem, you can reach out to us. You can mail us directly or indirectly. You can reach out to us. Thank you very much, and I'll see you around.